Usually when I explain to my patients, I'll divide them into immediate side effects and long-term side effects. So immediate side effects, generally people know about being tired, vomiting, nauseation, hair loss. So those are all true. But it doesn't necessarily make people so sick that they cannot carry out their day-to-day normal life. So the immediate side effects is on the day of chemotherapy, we give a lot of supportive medicine to make them feel good and not having so much side effects from the chemo. And the chemotherapy is not so rapid. The side effects doesn't happen within 24 hours. So usually they'll come to my clinic feeling well, going home feeling well. Some drive to the clinic, some take taxi, some take public transport. But I usually advise patients to come with someone the first time they come, just so that someone can give them moral support, and also to understand that chemotherapy is not as dramatic as they see on TV or movie. Second, third, fourth day is when the chemotherapy side effects start to sink in. Those are the days that we give other supportive medicine to stop them from feeling nauseated, to give them appetite, to make them feel not so tired. The anti-nauseation drug has improved a lot as well. We have chemotherapy side effect, but we also have side effect from the supportive medicine. So the anti-nauseation medicine will stop patients from vomiting, but it also can cause constipation. So we also give anti-constipation agents. After the fourth day, patients will start to feel better. But the first week after chemo, their taste bud changes. It's just like when we take antibiotics. Second week, patients starts to feel better, more energetic, can eat better. That is the time when the immune system is at the lowest, usually towards the end of the second week. So that is the time patients are likely to experience fever, more likely than other time. But having said that, only 5% of patients will have high fever needing hospitalization. 95% of patients will be fine. Third week, everything goes back to normal. Immune system, appetite, tiredness, everything recover. They are back to normal, just like before chemotherapy. That is the time when the hair starts to fall off. Once the hair falls off, it doesn't come back until we stop chemo. 100% guaranteed. 3 months of stopping chemo, from the last drop of chemo, 3 months later, the hair will completely recover. I don't have any patients that have lost the hair and never regained their hair. Some patients' hair come back quite different texture. Some is wavy, some is curly. Very important for patients or the caregivers to understand that chemotherapy is not easy, but it's not so terrible. The long-term side effects depends on individual drugs. Certain drugs that causes damage to the nerves, the long nerves of the body. 2 very good drugs for breast cancer can cause that, and usually it's the tips of the fingers and tips of the toes where they start to have numbness and tingling sensation. Usually first 2 years are the worst time, but after 2 years it gradually gets better, but it will never go back to 100%. So that is one of the permanent side effects. Then Herceptin, the very good new drug for the HER2 positive breast cancer. These are the drugs we are trying to move towards where the drugs are so clever, they just recognize cancer cells and go directly to cancer cells, do not affect the rest of the body. So Herceptin does not cause low immunity, does not cause hair loss, does not cause tiredness. The only thing it can cause is heart muscles, because in the heart muscles they have the same receptors. In the past, before this was aware, about 7% of patients could be their heart muscles are damaged by this drug. But now we monitor the heart function very, very closely. Every few injections we would check their heart function. So we learn as we go along, and we try to minimize side effects as much as we can. The schedule so far has been two weekly is the shortest, so 2 to 3 weekly, but more standard is 3 weekly. The reason we do it 3 weekly is for the chemo to have time to kill whatever cells that when they first enter, also for the body to recover. And we give it over 4 to 6 months. So we need to make sure patient is fit enough before they have the next cycle of chemotherapy. It's not no end to it. We do either 4 cycles, 6 cycles, or 8 cycles. So depending on the severity of the cancer and individual patients. But certainly by the final cycle, we would stop, and within 3 months, most things will recover.